Attachment and Biobehavioral Catch-up, also known as ABC. I'm going to start by talking a little bit about attachment. Attachment is the context in which children find security, safety, they develop trust, conscience, and self-worth. This develops gradually over first years of life and is based upon the relationship experience that they have with their caregivers. The parent or primary caregiver provides the children with a secure base from which the child can explore independently, but always return to a safe place. This is very important in a child's development. So what happens when attachment is not created? Children who experience early adversity, such as neglect, abuse, exposure to domestic violence, and separation from caregivers, are at a high risk of developing disorganized attachments. Children develop attachment disorganization as a result of being frightened of the person to whom they look for reassurance. And this is when the attachment and biobehavioral catch-up is an intervention that was developed by Dr. Marie Dossier. And the purpose of creating this intervention was to help parents or caregivers provide nurturing care and engage in synchronous interactions with their children. She also wanted to help parents or caregivers learn to behave in ways that support children's ability to develop self-regulatory skills. This was designed for young children and their parents who have experienced early maltreatment and or disruptions in care. This is focused mainly on infant and young children that are especially dependent upon parents for help regulating affect, physiology, and behavior. The ABC intervention is a training program for caregivers of infants and young children, which includes high-risk birth parents and caregivers of young children in foster care, kinship care, such as grandparents raising a grandchild, and adoptive care. What does it do? The intervention targets several issues, including providing nurturance for distressed infants, even when parents or caregivers are not comfortable providing nurturance. Overriding tendency to respond in kind to infant behaviors, and providing a predictable interpersonal environment. How it works. This is a relatively brief intervention. It's only 10 sessions, and it's 1-hour sessions once a week. This is a manualized intervention. It's implemented, it's given by parent coaches. The intervention focuses on changing parenting behaviors. And one of the key components, key factors in the intervention is that it involves children and parents. So these parents, while they're practicing new approaches, they get in the moment feedback, so they are offered words on how to react to different situations. And also, this is conducted in parents' homes. What is the problem being addressed? And it is because young children who have experienced early maltreatment and or disruptions in care can often behave in ways that push caregivers away. So it's hard for caregivers to find out what is really going on with their children. So ABC helps these caregivers to reinterpret children's behavioral signals so that they can provide nurturance even when it's not elicited, even when it's not asked for. Nurturance does not come naturally to many caregivers, but children who have experienced early adversity especially need nurturing care, so these will teach them how to react to specific situations. The ABC intervention, like I said, it's 10 sessions, and each of these sessions provides new information for the caregivers. These sessions, the session 1 and 2, are focused on providing nurturance when children are distressed. Sessions 3 and 4, they teach them how to provide a sensitive, responsive environment by following the child's lead with delight when children adopt distress. Sessions 5 and 6, they teach them how to behave in ways that are not frightening to children. On sessions 7 and 8, they teach them how to override their own issues that interfere with providing nurturing care and give them a better care to their own children. On sessions 9 and 10, all the knowledge that they have gained during the previous sessions, it's reinforced. They also get homework. It's assigned after each session, and it involves practice of the skill learned in the session. On this link at the bottom, I have a presentation on the ABC interview given by Dr. Marie Dossier, which is very informative, and it gives more about the intervention. What is the Informed Caregiver Project? This is a developmental psychology laboratory that is located at the University of Delaware, that was developed by Dr. Marie Dossier. And it's important because on the laboratory they conduct basic and translational research with children and families, and their main focus is the attachment and biobehavioral catch-up intervention. They investigate the effectiveness of the parent training intervention with families from a variety of backgrounds, and they also provide in detail information about getting certified on this intervention. What the research has shown, the research shows that children with disorganized attachments are associated with problematic outcomes. Very early and late in life, they have contradictory behaviors. They have apprehension of the parents, and they might present some stealing or freezing on given situations, on distress, most of all situations. The research was focused on participants. Again, both children and parents participate, and the clinical trial was they offered two kind of interventions: the ABC and a control intervention. The ABC was given as I have explained it at the beginning, and the control intervention has the same duration, but it was designed to enhance cognitive and linguistic development in children. It doesn't touch any of what ABC touches, so they could see the differences. And some of the findings were that ABC intervention is effective in promoting organized and secure attachment outcomes. Also, the ABC effects on early emotion expression might have implications on children's developmental trajectories. The results is that a relatively brief parenting program can change children's expression of negative affect. ABC children show a lower rate of negative affect expression during a series of challenging tasks than children in control intervention. The ABC children show less anger toward their parents, and the children in the ABC intervention have a significantly lower rate of disorganized attachment and higher rates of secure attachment relative to the control intervention. These results support the efficacy of the ABC intervention in enhancing attachment quality among parents and children. Why society and social world should be concerned about this? Because giving them a treatment is so common, and it's associated with problems regulating the expression of negative affect. It is critical that interventions target this issue, especially the issue of attachment. And ABC was designed to enhance children's ability to regulate their affect, behavior, and physiologically by helping parents self as co-regulators. Taken together, synchronous nurturing and non-threatening interactions are expected to enhance children's developing regulatory capabilities. Thank you.